and welcome to How to Gastro. In today's video, we're going to be talking about a very interesting childhood disease, and that is Erythema Infectiosum, which is also commonly known as fifth disease. So let's get started. So what is fifth disease? Erythema Infectiosum, also known as fifth disease, is a common childhood infection which is caused by the Parvovirus B19. The disease is especially common in kids aged 5 to 15, but adults may be infected too. Fifth disease causes a distinctive red rash on the face that makes the child appear to have a slapped cheek. A few days later, the rash spreads down to the trunk, arms, and the leg. The rash on the body is said to be very itchy and takes on the classic lacy net-like look. So from this definition of fifth disease, we get that it's actually a viral infection caused by the specific virus called the Parvovirus B19. So the disease is actually especially common in children aged between 5 to 15 years of age, but adults can get the infection too. So the classic manifestation of this infection are these rosy red cheeks, which is actually called the slapped cheek appearance, which is this red rash which appears on either side of the cheeks. And then after a few days, the rash will spread to the rest of the body, which includes the trunk, arms, and the legs. And here it can be very itchy and takes on this classic lacy net-like look. So it looks sort of like a lacy net on the rest of the body. So now that we know what the basics of fifth disease is, let's take a closer look at how one can contract the disease. So the Parvovirus B19, which causes fifth disease, spreads through respiratory secretions such as saliva, sputum, or nasal mucus when an infected person coughs or sneezes, causing viral particles to fly into the air. So as we can see in this little video playing on the top right hand side of my screen, we see what happens when a person who has the Parvovirus B19 coughs or sneezes, and then millions of these viral particles are then released into the air and can then be breathed in by someone standing close by. So as we can see, it actually spreads pretty quickly in a household where multiple kids live, because once one child gets it and they come into contact with another child, the disease can actually spread quite quickly between them. So the Parvovirus B19 can also spread through blood or blood products. So this means that it can actually be spread through a blood transfusion, either of whole blood or even platelets or something like that. And a pregnant woman who is infected with Parvovirus B19 can actually pass the virus on to her baby. So as we can see, the disease can be spread in multiple ways. So now let's explore some signs and symptoms of fifth disease. So fifth disease starts with a low-grade fever, a headache, a rash, and cold-like symptoms, which include a runny and stuffy nose. These symptoms pass, and then a few days later, the rash appears. So this is that classic rash which appears on the face, which gives the child the slapped cheek appearance. So the bright red rash most commonly appears in the face, particularly on the cheeks, and this is the defining symptom of the infection in children, hence the name slapped cheek disease. So in addition to the red cheeks, children often develop a red lacy rash on the rest of their body, with the upper arms, torso, and legs being the most common locations. So the rash typically lasts a few days and may be very itchy, and some cases have actually been known to last for several weeks. So something very interesting about this disease is that teenagers or adults who get infected may actually present with a self-limited arthritis, which means the swelling of the joints in the body. So this manifests as the painful swelling of the joints that feels similar to arthritis. And these patients may experience a difficulty in walking and in the bending of joints, such as the wrists, knees, ankles, fingers, and even the shoulders. So in the younger children, we have the classic flu-like symptoms, which appear first, which is the fever, the headache, the stuffy nose, and the runny nose. Then we have the development of this slapped cheek appearance with the rash which develops on the cheeks. And then a few days after that rash on the cheeks, we have the lacy rash which develops in other parts of the body. And in addition to all of these symptoms, teenagers or adults who get the infection can also present with painful joints or the swelling of joints, which will present as redness and a difficulty in movement and stiffness within these joints. So now that we know what the signs and symptoms of the disease are, let's take a closer look at how one can diagnose this disease. So the diagnosis of this disease is usually based on the classic slapped cheek rash, which is noted on the clinical examination of the patient. In rare cases, blood tests can be done to look for specific antibodies against the Parvovirus B19. And the antibodies are special proteins made by the immune system to help protect our body against viruses or other invaders. So usually the diagnosis is a clinical one, meaning that the classic slap cheek appearance is usually a dead giveaway, and the diagnosis can be made in this way. But if a doctor is unsure or has trouble differentiating the disease from another disease, we can actually do a blood test where we look for the antibodies specific to the Parvovirus B19. And in this way, we can confirm the diagnosis of fifth disease. And finally, let's talk about the treatment of fifth disease. So the only available treatment is supportive treatment. So plenty of fluids, acetaminophen, and rest can provide some relief to these patients. And patients with persistent arthritis, which is usually teens and adults, can use anti-inflammatory medications such as ibuprofen or naproxen, though children should not take aspirin due to the risk of developing Rye syndrome. So the treatment of this disease is basically supportive. So rest, plenty of fluids, acetaminophen for the pain and fever, as well as ibuprofen. And in patients who develop the arthritic manifestations of the disease, we can use ibuprofen here or naproxen to treat the arthritis. And that brings us to the end of this video on fifth disease. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure to turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.